Here is a number that surprises most people the first time they hear it. After the age of 30, the human body loses between 3 and 8% of its muscle mass every decade. This process accelerates with age, and one muscle group is affected more than any other: the glute muscles. These are the largest and most powerful muscles in your body, yet they are also the ones that weaken the fastest as we get older. What makes this especially concerning is that most people do not realize when their glutes are getting weaker. You do not feel it directly. There is no sharp pain at first. Instead, the changes show up quietly. Standing up from a chair feels harder. Climbing stairs requires more effort. Balance feels less stable. Over time, these small changes add up to a much bigger problem. Many doctors and fitness professionals recommend walking as the main exercise for older adults. Walking is excellent for cardiovascular health and circulation, but here is the part that is rarely explained. Walking barely activates your glute muscles. Scientific measurements using electromyography show that normal walking activates only about 20 to 30% of glute muscle fibers. That means the muscles responsible for stability, balance, and power are largely left unused. Now compare that to targeted glute exercises. Research shows that specific movements can activate up to 90% of the same muscle fibers. That difference is enormous. It explains why many seniors walk every day and still struggle with balance, back pain, or weakness when standing up. Weak glutes are not just a cosmetic issue. They are directly linked to serious health risks. Research published in the American Journal of Physical Medicine and Rehabilitation found that seniors with weak glute muscles are 67% more likely to experience falls. Falls are one of the leading causes of injury, loss of independence, and hospitalization after 60. Other studies have linked glute weakness to chronic lower back pain, knee problems, and poor posture. When the glutes stop doing their job, other joints and muscles are forced to compensate. The spine takes more load. The knees absorb more stress. Balance becomes unstable, even during simple daily activities. Here is where most people assume the situation is hopeless. They believe strengthening the glutes requires squats, lunges, or standing exercises that feel unsafe or painful. For anyone with knee pain, hip replacements, arthritis, or balance concerns, these movements can feel impossible. Many people give up before they even start. But this assumption is wrong. What research has shown over the past decade is that some of the most effective glute-strengthening exercises for people over 60 can be done while sitting in a chair. These exercises are not a compromise. In many cases, they produce muscle activation levels similar to standing movements, without the same risk. Researchers at major universities have tested seated exercises specifically in older adults. The results are clear. When done correctly and consistently, seated glute exercises improve strength, coordination, and stability. For many seniors, this approach is safer, more comfortable, and easier to maintain long-term. In this video, we are going to walk through the most effective seated exercises for rebuilding glute strength after 60. They are ranked from helpful to absolutely essential. Each one serves a specific purpose, and together they form a complete system for improving balance, reducing fall risk, and restoring confidence in everyday movement. The number one exercise on this list is especially important. Physical therapists have used it for decades in rehabilitation settings, particularly after hip surgery. Clinical trials show that it can increase glute strength by over 30% in just 8 weeks. Most people have never been taught this movement, even though it is one of the safest and most effective options available. Before we begin, take a moment to think about how your body feels right now. Is getting up from a chair harder than it used to be? Do stairs feel unstable? Do you ever feel off balance for no clear reason? These are often early signs of glute weakness, not just getting older. Let us start with the foundation. The first exercise prepares your hips and nervous system for everything that follows. It looks simple, but it plays a crucial role in waking up muscles that may have been inactive for years. Let us begin with the exercise ranked at number 6 on our list. This movement is not meant to exhaust you. Its purpose is to wake up the muscles and prepare your body for stronger activation later. Many people skip this step, but research shows that preparation is critical for older muscles to respond properly. Number 6. Seated marching. Seated marching looks simple, and that is exactly why it works so well as a starting point. When you lift one knee at a time while sitting, you activate your hip flexors and begin re-engaging your glutes in a gentle, controlled way. This movement also improves coordination between your brain and lower body. Studies involving adults between 65 and 80 have shown that seated marching improves hip mobility and lower body coordination within weeks. These improvements matter because coordination is what allows the glutes to fire correctly during more demanding movements. To perform seated marching, sit in a sturdy chair with your feet flat on the floor and your back upright. Slowly lift one knee toward your chest as high as you comfortably can. Hold for 1 second, then lower your foot back to the floor with control. Alternate sides. The key is the slow, lowering phase. This is when the glute muscles work hardest. Aim for 3 sets of 15 repetitions per leg. Perform this exercise at the beginning of your routine, 2 to 3 times per week. Number 5. Seated leg extension with glute squeeze. The next exercise adds a critical element that many people miss: intentional glute engagement. While leg extensions are often thought of as a thigh exercise, adding a deliberate glute squeeze turns this into a powerful lower body movement. Research shows that combining leg movement with an isometric muscle squeeze significantly increases muscle activation and joint stability. For older adults, this translates directly into better balance and safer movement. Sit upright in your chair with your feet flat on the floor. Extend one leg forward until it is almost straight. At the top of the movement, squeeze the glute on that side firmly and hold for 3 seconds. Then lower your leg slowly while maintaining tension. Complete 2 to 3 sets of 12 repetitions per leg. Focus on control, not speed. If it helps, place your hand on your glute to feel the muscle contract. This improves the mind-muscle connection, which becomes increasingly important with age. Number 4. Seated hip abduction. At number 4 is a movement that targets the gluteus medius, a muscle on the side of your hips that plays a major role in balance. Weakness in this muscle is strongly associated with falls because it allows the pelvis to tilt and sway during walking. Sit near the front edge of your chair with your feet flat on the floor. Place your hands on the outside of your knees. Gently push your knees outward against your hands while resisting the movement. Hold this contraction for 5 seconds. Then relax. This isometric contraction has been shown to activate the gluteus medius at a very high level. Even without standing, perform 3 sets of 10 holds. Breathe normally and avoid holding your breath. If you have a resistance band, you can loop it around your thighs and push your knees outward against the band for a dynamic version of the exercise. Number 3. Seated glute squeezes. This exercise may be the most underestimated movement on the list. Many adults over 60 experience what researchers call gluteal amnesia, where the brain no longer activates the glutes efficiently after years of sitting. Seated glute squeezes help re-establish that connection. Sit comfortably with your feet flat on the floor. Without moving your legs, squeeze both glutes as tightly as you can. Hold for 5 seconds, then relax for 3 seconds. Repeat 10 times. Research shows that performing several short sets of glute squeezes throughout the day improves muscle activation during walking and standing. These can be done anywhere and require no special setup. In the next part, we will cover the final 2 exercises. These are the most powerful movements in the entire routine. One of them is considered the gold standard by physical therapists for rebuilding glute strength safely after 60. Part 3 is where the biggest changes happen. We have now reached the top of the list. The final 2 exercises are where the most noticeable changes happen. These movements do more than wake up the glutes. They rebuild strength, correct imbalances, and restore stability in ways that directly affect walking, standing, and balance. Number 2. Seated single-leg glute press. This exercise addresses a problem that almost everyone has, but few people recognize: glute imbalance. One side is usually stronger than the other, often without you realizing it. Over time, this imbalance places uneven stress on the hips, spine, and knees, increasing pain and instability. Research in adults over 55 shows that correcting glute imbalances significantly reduces lower back pain and improves balance. The seated single-leg glute press is one of the safest ways to do this. Sit near the front edge of a sturdy chair. Place one foot flat on the floor and extend the other leg straight out in front of you so it hovers just above the ground. Now press the grounded foot firmly into the floor and squeeze the glute on that side. Using that glute power, lift your hips 1 to 2 inches off the chair. Hold for 3 seconds, then slowly lower back down. Complete all repetitions on one side before switching to the other. Start with 2 sets of 8 repetitions per leg. Pay close attention to your weaker side. It should feel more challenging. That is exactly the side that needs the work. Unilateral exercises like this force each glute to work independently. Studies comparing one-leg movements to two-leg movements consistently show higher muscle activation and better balance improvements with unilateral work. Number 1. Seated glute bridge. The number 1 seated exercise for rebuilding glute strength after 60 is the seated glute bridge. Physical therapists consider this the gold standard for safe and effective glute rehabilitation. It was originally designed for patients recovering from hip surgery, but research quickly showed that it works just as well for healthy older adults. Clinical trials following adults between 60 and 78 found that seated glute bridges increased glute strength by over 30% in 12 weeks. That improvement was greater than what was seen with many standing exercises, largely because the chair provides stability and removes balance concerns. To perform the seated glute bridge, place a sturdy chair against a wall so it cannot move. Sit on the front half of the chair with your feet flat on the floor, about hip-width apart. Your knees should be bent at roughly 90 degrees. Place your hands on the sides of the chair for support. Press both feet firmly into the floor and squeeze your glutes. Using that squeeze, lift your hips upward until your body forms a straight line from your shoulders to your knees. Keep your shoulders supported by the chair. At the top, hold the position for 2 seconds while squeezing your glutes as hard as you can. Then lower your hips slowly over 3 seconds. This exercise works because it combines body weight resistance, optimal joint positioning, and stability. Muscle activation studies show that the seated bridge activates the gluteus maximus at very high levels, comparable to much more demanding exercises that carry higher risk. For best results, perform 3 sets of 12 repetitions, 3 times per week. As you get stronger, you can increase the hold at the top to 5 seconds, or try a single-leg variation to further challenge each side. Putting it all together. These 6 seated exercises form a complete system for rebuilding glute strength after 60. They address activation, coordination, balance, and power. They are safe, accessible, and backed by research. Consistency is the key. Most studies use a minimum of 8 to 12 weeks because muscle adaptation takes time, especially later in life. The seniors who see the best results are not extraordinary athletes. They are ordinary people who show up regularly and perform the movements with control. Strong glutes support your spine, protect your knees, improve balance, and reduce fall risk. Weak glutes are not an inevitable part of aging. They are the result of disuse, and disuse can be reversed. Start with seated marching to wake up the muscles. Progress through the list as your control improves. Make the seated glute bridge your top priority. Small, steady improvements add up to meaningful change. If you found this video helpful, share it with someone who might benefit from these exercises. And let us know in the comments what you find most challenging right now. Balance, back pain, or getting up from a chair. Your experience may help someone else take their first step toward stronger, more confident movement. Thanks for watching.